As many of you know, the state legislature is currently analyzing the possibility of legalizing recreational marijuana. This is a state policy that would have significant ramifications for the 12.5 million people that live in our Commonwealth. Now, as a policymaker myself, I look at every matter of new policy. In my mind, I kind of look at it as though we're on a balanced scale. I put the good things on one side, the bad things on the other, and kind of see where they might come out. So as I analyze this particular policy, and we've had a number of hearings on it, I start to weigh those different goods and bads. So on the good side, we heard that from the governor. There's revenue to be expected if we legalize recreational marijuana. But is there really? We also hear from other states, and the testimony we've had from them, that there are social costs that come along with that policy as well. There are costs to insurers. There are costs to manufacturers. Certainly costs to families. That makes that scale tilt a little bit the other way. What's another good? We hear that there's social equity that can come about through legalizing recreational marijuana. But when we analyze that issue a little deeper, we find that that's not necessarily the case. To begin with, many of the positives on the judicial, on that end can be achieved through other means. We also find that there is a cost as well from other states that have done this. Where do a lot of the recreational stores end up? They end up in disadvantaged neighborhoods. Is that benefiting the neighborhood in the way that you would say perhaps liquor stores benefit the neighborhood? Maybe not so much. So as we weigh these, now what do we see on the other side? The social costs. We see the cost in equity to members of disadvantaged societies, the cost to families, the cost to insurers, the cost to all these different individuals. We see increases in use. We see increases in cannabis disorder. We see increases in accidents. All of these things really make that scale tilt really heavily to one side. But when you dig in the statistics, I would encourage you just to think about this in terms of a family. I have a family, I have kids. I have a 17-year-old son, for example. I think about him. What kind of decision would I make in my own family that would cause such a risk to him? If someone said, well, Paul, you might be due some additional money. How about we pay you some additional money? Now, the downside is your 17-year-old son might be 11% more likely to become a daily marijuana user. Now, what do we want as parents? We want our children to grow up, to become successful, to get married, to have kids, to have grandkids in my future, God willing. If someone said, well, for a little bit of money, Paul, it'll probably not happen to you. It does happen to some people. There's about an 11% chance that your son may end up as a daily marijuana user. What parent would make that decision? What policymaker sitting under the Capitol dome would make a decision like that? One that they know, for nominal, if any, financial benefit, there is such extreme harm. We always should apply a do no harm policy to all of the initiatives that we have. Glad to have a great lineup of speakers today. Next, I'd like to recognize as Representative Rob Kauffman, who's the chair of the Minority Judiciary Committee.
Thank you, Paul. And there was a hearing of the subcommittee of the Health Committee and the Judiciary Committee this morning, which talked about this issue, and Representative Schemel, Representative Rapp, Representative Twardzik were all part of that discussion this morning. I think it brought out some great points. As someone, I've been born and raised in Pennsylvania, my children born and raised here in Pennsylvania, and now I have two granddaughters here in Pennsylvania. This is absolutely an issue of families, and it's an issue of our youth. It's an issue of the next generation, the generation that will hopefully bring us out of the mess we are in here in America. And the legalization of marijuana makes marijuana more accessible and acceptable in our society. It helps to build upon the false narrative that marijuana is safe, as advocates continuously seek to downplay the risks, despite the fact that today's marijuana is anywhere from 7 to 30 times as potent as the weed of the baby boomer era. There is mounting evidence that marijuana negatively impacts mental health, cognitive, emotional, and social development. With repeated use, alterations of brain chemistry causes long-lasting effects, including psychosis, schizophrenia, social anxiety, and suicidal ideation. Nowhere are these harms more critical than in young Pennsylvanians. Studies have found teens who regularly use marijuana experience an 8-point decrease in IQ. They have poorer educational outcomes. They are less likely to finish or obtain a degree. And experts warn that cannabis use can interfere with the ability to form relationships, succeed academically, and hold down a job. We attempt to warn young Americans of the risk of smoking, vaping, prescription drug abuse, alcohol abuse, gambling, social media, and the list could go on. Now policymakers in the Commonwealth are posturing to put our stamp of approval on cannabis use without acknowledging the harms known or the harms unknown. We will be poised to do a human trial with very potent marijuana on a generation of our young people in the midst of an era where they have greater societal pressures than ever before. Big business and big government will cash in temporarily, and 10, 15, or 20 years down the road, we will have the warnings, the public service announcements, and the marijuana cessation programs paid for by the taxpayers. The legalization of recreational marijuana is a social experiment that will endanger the next generation of Pennsylvanians, and the Commonwealth can absolutely not afford it. Thank you very much, and with that, I will introduce my good colleague, Tim Twardzik.
Thank you. Good afternoon. We've heard a lot about marijuana the last several months in several testifiers who came in front of our committee, and it's all about trying to make sure that we have safe supply of marijuana for our communities. But that already exists because there are medical marijuana facilities available through Pennsylvania. And originally, there were 17 serious medical conditions in Act 16. Now there are 24. The law allows the Medical Marijuana Advisory Board to make recommendations to the Secretary of Health to add these new conditions and qualify someone for marijuana. The Secretary can approve or disapprove the condition. If approved, it gets a qualifying condition, so the legislator is no longer required to add new conditions. It's out of our hands. It's not our laws anymore. Now, the added condition of anxiety now accounts for over 40% of the medical marijuana prescriptions. This is difficult situation where people are coming in for, they're talked about the opportunity to help cancer patients and serious causes, but anxiety was just added and now adds over 40% of the volume through the stores. Act 16 also called for studies to review the effects of medical marijuana that it would have on Pennsylvania citizens. We have yet to complete those studies and see the results. I think it's time to slow the speeding train for the marijuana for all until we finally take a look at the effects. I thank you and like to introduce Matt Weaver of Compass Mark.
Thank you so much. Good afternoon. My name is Matt Weaver. I'm the program manager for Compass Mark, a science-based addiction prevention organization in Lancaster, Lebanon, and Chester counties, where our mission is to prevent addiction through education, skill building, and community mobilization. In the field of prevention, we work with and provide resources for individuals across the full lifetime age spectrum. However, my primary expertise is working with adolescents and young adults. For that reason, I have major concerns about the future of our children's mental health and physical wellness regarding the access, availability, and potency of THC products, especially in states where marijuana is legal for adult use. Cannabis today is not the cannabis of any other decade. THC potency in the mid-90s for the combustible plant-based product was around 3.75%. Whereas in 2024, THC potency averages 17 to 20%. More concerning yet, the availability of highly concentrated THC products like edibles, wax, oil, and shatter can average anywhere around 50 to 60% and is also made available for up to 99%. These levels of potency are not naturally found freely growing from the earth, as you'll hear many argue from the pro-cannabis supporters. These products are man-made and bred for high potency, which is leading to an increased risk of marijuana users to have a form of cannabis use disorder. The same data suggests that cannabis use disorder increases sevenfold for those under the age of 18. Another concerning harm was reported in a 2023 study that shows within the first 5 years of legalization in Colorado, it was reported a 46% increase in hospitalizations due to cannabis hyperemesis, which is a cyclical, uncontrollable vomiting syndrome, and we're seeing that trend continue across the country. Additionally, a study in 2019 shows that frequent users of these high-potency products are at a risk for mental health disorders like schizophrenia, lifetime depression, and anxiety, which can be debilitating for many. Unfortunately, these same mental health concerns among young people are on the rise, and they are using marijuana to self-medicate and perpetuating a vicious cycle of dependency and increasing the risk of suicide, which is the second leading cause of death for youth and young adults ages 10 to 24. These are not just minor, slap a Band-Aid on it type of harms. These can be life-altering consequences that will not only be felt by the individual, but their friends and their families and their communities as well. Additionally, there will be societal impacts felt in the Commonwealth if marijuana legalization was to pass, similarly to those of other states who have legalized marijuana over the past decade that they have experienced. We have the distinct privilege and opportunity to learn from others' mistakes. Our children and our society deserve to be protected from cannabis legalization, which will inherently lead to normalizing and commercializing another drug industry that only regards increasing use to profit off of addiction, while completely disregarding the consequences related to poor societal mental health, physical health, and social emotional well-being. Now, if you are someone who supports full marijuana legalization in Pennsylvania, I simply ask that you just consider your motivations for that support, because it's not based on science, it's not based on public health, and it's certainly not based on the well-being of our children's future. Now I'd like to introduce Judge Cheryl Allen from PA Family Institute. Thank you.
Well, good afternoon, everyone. Thank you for giving me this opportunity to speak on a subject that is near and dear to me. I have spent my career first as an elementary school teacher, then as an attorney working with children and youth services in Allegheny County, as a juvenile court judge, and as a criminal court judge. And I can tell you that the overwhelming majority of children who come into the child welfare system pursuant to a dependency adjudication come from homes where parents are rendered incapable of caring for them because of addiction. I would say also that the majority of people who come through the criminal justice system also come because of an addiction or a drug-related crime. I have learned through experience that there is no such thing as a harmless controlled substance, and that is why the substance was controlled in the first place. Marijuana is not a harmless substance. Every drug addict I know, and I have worked with thousands during the 17 years of my work on the bench in Allegheny County and my work as a county attorney, every addict I know started out using marijuana. Marijuana, people do and can and do become addicted to marijuana, especially young people. And marijuana occurs at a tremendous cost to families, to teenagers, to society. And it's from this experience that I oppose the legalization of recreational marijuana. The purposes of government include to establish laws, maintain order and provide security, protect citizens from external threats, and promote the general welfare by providing public services. Legalizing marijuana for recreational purposes will not serve any of these purposes. The main benefactors of legalizing marijuana for recreational use will be the corporate giants who are attempting to position themselves to reap profits at the expense of Pennsylvania citizens, especially young people. And in order to advance their agenda, they're also talking constantly about social equity. You know, we must have, or they must have, diversity among those who manufacture and sell marijuana. But their definition of diversity is that people look differently, but all think the same. And by thinking the same, they're thinking about profits and not people. When we talk about social equity and racial discrimination or racial equity, I would point out to them that the people who suffer the most from the legalization of any controlled substance are the very people that they're talking about protecting. An extreme disproportionate number of the people, the families that I saw in juvenile court in Allegheny County, a county where only 12% of the population is black, were black families, and I would say more than 60%. And the same can be said for criminal justice. So marijuana legalization will benefit a few in the name of social equity, while the masses continue to suffer. There's also a lot of talk about inequities in the criminal justice system. And yes, there are some inequities in the criminal justice system, especially as it relates to the way that law enforcement enforces the crimes code. But conflating the need for criminal justice reform with legalizing recreational marijuana is wrong. The argument is that marijuana must be legalized for recreational purposes and use to cure these racial disparities. However, these disparities can be cured and can be fixed by educating young people about engaging in crime and looking at some of the laws and how they are enforced in our society. No one would argue that crack cocaine, heroin should be legalized for recreational use so that racial disparities in prosecution can be eliminated. The negative impact that illegal drugs have had on the black community goes far beyond racial disparities and criminal prosecutions. Should we ignore the violence and death that accompany drug dealing? Should we ignore the broken homes and the traumatized, neglected children who end up in the foster care system because of drug addiction? Should we overlook the physical, emotional, mental, and behavioral problems that our young people suffer from drug use? We should not fall into the trap of attempting to correct a wrong with another wrong, because all we will end up with is wrong. In court, when someone enters a guilty plea on anything, part of the plea colloquy is to make sure that they are doing so completely, voluntarily, and not under the influence of anything. The same should be true in life. We should not be legalizing any mind-altering chemical for recreational use. It would be a serious setback to society, and you cannot right any societal problems using a wrong method. Legalizing marijuana for recreational use is wrong for Pennsylvania, it's wrong for our young people, and it must be rejected. And I would like to introduce David Taylor from the Pennsylvania Manufacturers Association.
Thank you very much, Your Honor, and thanks to everybody for being here today. I'm David N. Taylor. I'm the president and CEO of the Pennsylvania Manufacturers Association. We're the statewide not-for-profit group representing the people who make things in Pennsylvania. And my view on this issue is somewhat different, and it's going to take me a little bit longer to lead you to my conclusion. So I beg your patience, but just work with me, please. So manufacturing in Pennsylvania represents about $100 billion of value added every year. It's over 500,000 jobs on the plant floor, and that core manufacturing activity sustains millions of additional Pennsylvania jobs in supply chains and distribution networks and from the vendors of industrial services. Manufacturing is the industrial sector that adds the most value, and so our employers are able to offer the best wages and benefits in the marketplace. Manufacturing jobs are family-sustaining jobs. Now, Pennsylvania is in the midst of a workforce crisis that in my sector, there are many thousands of good-paying, family-sustaining jobs that are open, where our employers can't find qualified new hires. My friends at the Pennsylvania Chamber of Business and Industry have a statistic that they got from the U.S. Chamber. For every 100 jobs in Pennsylvania, there are 74 workers. This is a real challenge. It constitutes a hard cap on economic growth, because even though I'm told by our members that there's work available, you can't go after it, you can't bid on it, because there's no way to increase capacity to do the work if you got it. So this is a real crisis, but crisis also brings opportunity. That through sheer undeniable need, that our employers are going to have to cast the net wider and consider candidates they would not have considered before, including people who've been outside the workforce, long-term unemployed, people coming off welfare, people coming out of jail. For as many of us as can meet the moment, both on the employer side and on the ex-offender side, the new employee side, if people can level up, we can help these people who come from marginalized communities to have an actual ownership stake in American society through a family-sustaining job. And with it, the dignity of work, the sense of identity, the sense of purposefulness that people need. Employers are willing to take a calculated risk. They're not willing to take an unacceptable risk, and that brings us to the issue of the day. So, especially for manufacturers, you think about what happens on a manufacturing factory floor. You have heavy equipment, bladed instruments, high voltage, extreme temperatures, chemical reactions, a lot of really serious things going on. So workplace safety is non-negotiable. I mean, beyond the profound moral responsibility that employers have to protect their workers, there are also very serious legal responsibilities. OSHA is not optional for us. The workers' comp law is not optional for us. The threat of ruinous lawsuits if, God forbid, there's an industrial accident and people are maimed or again, God forbid, killed. Those things are real for us and our members. And so if a new hire, if a potential new hire can't pass pre-employment drug screening, we can't hire you. We can't have you on our plant floor. It's nobody's opinion. This is the law. And one of the things about this conversation over the years that has really frustrated me is that you don't have to take my word for it. If you go to a cabinet manufacturer in the city of York, Wolf Home Products, that company requires pre-employment drug screening. And for all the years that Governor Wolf was pushing the mass commercialization of recreational marijuana, no one ever asked him about that. Said, sir, you were the president of that company. Was that policy put in place by you? Was that policy already in place when you got there? If it was, why did you leave it there? And again, this is just part of the reality check that we need to have before we take the plunge on an issue like this. I would hope that it would be a consensus issue for all of us, that we would want the people who have been without the dignity of work, people who have been unemployed, underemployed, people who don't have enough, for them to be able to take up a family-sustaining job. And it's not just manufacturing. There are a lot of other industries where you have to pass a pre-employment drug screening. And I mean, like for Commonwealth employees, they're subjected to randomized drug testing. So the opportunity cost that would come from mass commercializing recreational marijuana is significant, and the worst outcome would be for the state to get a piece of the action, because what would happen then would be, as we have seen with the state stores, as we've seen with the state lottery, as we've seen with the casinos, that ultimately the Commonwealth itself would be advertising, advocating the underlying activity, and at that point we would have our own state government working to make more of our citizens unemployable. So again, these are very consequential matters, and I hope that they'll be deliberated with the seriousness that they deserve. So I thank you, and I want to now introduce Detective Tony Marcocci from Westmoreland County.
Good afternoon. My name is Tony Marcocci. I'm a Westmoreland County detective and have been employed by the Westmoreland County District Attorney's Office for the last 45 years. For the last 39 years, I have worked in the Vice Narcotics Unit. During my employment, I have made drug purchases from street-level dealers up to major narcotics traffickers. I have prosecuted individuals in murder-for-hire cases. I've seen a lot in my career while working narcotics. I was working the streets back in the mid-1980s when we first experienced the crack cocaine epidemic. I saw firsthand how crack cocaine changed individuals' lives, partially because of the addictive qualities of crack cocaine, but also because of the availability of crack cocaine. I was also working the streets in the early 2000s when Colombian heroin and the opioid epidemic first started. I have watched people I know die from these deadly drugs. We in law enforcement know that whatever adults are using will be used and abused by children. I've seen it with alcohol, I've seen it with crack cocaine, I've seen it with heroin and marijuana. As an example, we have 13 ambulance services, local ambulance services in Westmoreland County. I checked with one of them. In the past year of 2023, 15 children under the age of 18 were taken to the emergency room via ambulance for THC overdoses. The scary thing is that so far this year, from January 1st, that same ambulance service has transported 12 children in 3 months. In checking with one of our local hospitals, I found that in the past year, 180 children, most of whom were between the ages of 12 and 18, screened positive for THC. I personally find these numbers alarming. We have seen the numbers of individuals using drugs for a variety of reasons grow exponentially. And it always filters down to our youth. If we pause and reflect back approximately 2 decades ago, money and greed led our country to one of the biggest epidemics in modern times, the opioid crisis. Have we learned nothing? Thank you. I'd like to introduce Judy Rosser.
Thank you. My name is Judy Rosser. I'm with Blair County Drug and Alcohol Partnerships, and I am also an officer for the Pennsylvania Association of County Drug and Alcohol Administrators. I've worked in the field for over 38 years. First 9 years of that was in treatment, and then in the last 27 years as what is called the Single County Authority for Blair County, and that is the agency that receives federal and state funds and is responsible for planning to address substance use disorders with those funds in our communities. Every county has an SCA. I'm here to speak about prevention and what we're seeing. That was something I didn't know a whole lot about when I started in my job in '97. But I came to learn very quickly it's probably one of the most researched areas of substance use disorders around the disease of substance abuse. And what we found, it's been researched for over 30 years through Hawkins and Catalana, and they did a lot of research around this disease and the risk factors and the protective factors that help impact a community and their ability to hold back the tide around this disease in their community. And what we found and what we know is there's 2 risk factors that have more impact on ability to change the trajectory of this disease than any in a community. And that is, number 1, the availability of those substances in our community. The second risk factor is the individual's perception of harm, whether they should use this substance. Those are our two top risk factors. Think about what we're talking about today. We're talking about legalizing another substance, controlled substance, that we know has impact on the brain. We know the science around this, but no one's talking about the science in relationship to this disease and the impact on the developing brain of a youth. I'm going to tell you a story about a young girl, had a lot of trauma, grew up in a middle-income family, but had some trauma in her early age. She was college-bound in high school, but was introduced to one of two of the drugs that were accessible at that time, tobacco. Started first with tobacco, went on to alcohol by 15, and by the summer before her 10th grade year, started using marijuana. She went from a college-bound student to being able to barely graduate as a general ed student. She went on to use this substance, marijuana. She not only used marijuana, immediately her trajectory went right into other drugs, immediately. Went from that to seeking to get high. Her brain was impacted. We cannot make generalization statements around these drugs because we do know that there is at least a 10% prevalence rate of substance use disorders in our community. Are we willing to sacrifice the youth and the adults in our community? This woman went on then to using the substance for over the next 12 years before she got into recovery. Today I stand in front of you with 34 years of recovery. That story was about me. I am a person in long-term recovery, and I had a cannabis use disorder, using it daily. And it impacted my life immensely until I got in recovery. And today I am an advocate around this issue, not just marijuana, but the stigma that comes along with this disease. One of the other things that we know from prevention is there are strategies that we can impact this in our community. And one of the biggest but the hardest strategies we have is an environmental strategies. So what's an environmental strategy? It's policy development. Let me give you an example. Back about, about 12 years ago, I might have the time frame a little wrong, we worked very hard to get legislation for smoke-free environments. That policy change had a direct impact on normalization of smoking in the community. And we saw our tobacco use rates drop within the next 2 to 3 years. They just started going down until the industry did a workaround and started developing vapes and other forms of using tobacco so that their numbers would continue to go up. And guess who now these hands of the vapes are in? Our Pennsylvania Youth Survey data shows that youth as young as 6 are using vapes and they don't even know what's in them. They have no idea. If you don't believe me, go to the Pennsylvania Commission on Crime and Delinquency, look at your PAYS data for Pennsylvania. Our youth are seeing these things and it is normalized with them. So environmental strategy is one of the biggest impacts that we can have. I ask our legislators, please step back. Someone said it here earlier. Do no harm first. Step back and look at the public health approach to this. Look at the research. Understand what we're dealing with when it comes to legalization. We need to have an environmental strategy that puts guardrails that protects the community, especially the most disadvantaged, because that's where this special interest groups will target. And we need to have a voice for those that don't have a voice. So I ask our legislators to please step back, research it. What are we in a hurry for today? We don't have to hurry into this legislation. You need to take time and really consider what we're doing and the impact on our community. We're in direct service. Prevention is hard. we will not be able to impact. We're already seeing from medical marijuana, from the medicinal approval, 70% of my admissions of adolescents are for marijuana. We actually had to work with our schools to help them get rid of vapes, and they have THC vapes in their hands. They're getting them. Someone said it here earlier. Once it becomes available in the community, the youth will have access to it. So please, I ask the legislators to step back, please do no harm, and really understand your research. Thank you.
Thank you, everyone, to all of our testifiers. As we hurtle toward this policy decision, a policy promoted by the governor, promoted by others in the legislature, there are a number of us that are trying to put the brakes on and say there's much more to be discovered here. And what are the true intents and interests of those who want to promote this kind of policy? So we will remain vigilant in trying to meet these questions as they come up. And if you have any questions, we'll be around afterward too. You're welcome to ask. Thank you so much.